Hello and welcome to today's live stream on the new Race Against Dementia UK DRI Innovative Fellowship Scheme. I'm delighted you could join us. I'm Adam Smith, I'm the Programme Director for Dementia Researcher, and regular viewers will know that I'm a big fan of everything that RAD and the UK DRI does, so I'm particularly excited to be talking with them today about this new fellowship programme, which represents an exciting new collaboration with its aim to support the next generation of researchers working at the intersection of dementia and artificial intelligence. Let me bring on my brilliant guests. Over the next hour, we're going to be hearing from Lydia Beaton, who's the Chief Operating Officer and Interim CEO at Race Against Dementia, and Dr. Natalie Duggett, who's a Science Programme Manager at the UK DRI. Hi, both of you. Thank you very much for joining. So we're going to have, let me just pop the program up on the screen so you can see what we're going to be talking about. So first of all, we're going to hear from Lydia, who's going to give us some background and information about Race Against Dementia. Then Natalie is going to run us through all the information you'll need about the fellowship scheme. And then we'll have a chance for discussion and questions at the end, and we'll have you on your way in about an hour's time, and we'll flag up some QR codes and links and things across the screen throughout. So feel free to post your questions at any time. If you're watching on YouTube or on X, you can use the comments, and the same goes for LinkedIn as well. So do post those throughout, and we'll do our best to bring them into the discussion at the end. But with that, I'm going to hand over first of all to Lydia, who is going to talk to us about Race Against Dementia.
Brilliant. Thank you, Adam. That's fantastic. Thank you, everybody, for joining this session. And it's a real pleasure to be able to talk to you today about this new fellowship scheme that Race Against Dementia has launched in partnership with UK DRI. So as Adam says, my name's Lydia. I head up operations at the charity and have also spent the last year as the CEO covering a maternity. So some of you may have met me before, but for those who don't know Race Against Dementia, I hope that film at the start was a good introduction as to the charity that we are, that is Race Against Dementia. So for those of you who don't know very much about the charity, we were formed by Sir Jackie Stewart. Sir Jackie was a 3-time Formula One world champion. He raced nearly 100 races, nearly 100 Grand Prix races, and he had a hugely successful career in motorsport. And following that time in motorsport, he then went on to campaign for safety on the track. When he was racing Formula One cars, there wasn't even an ambulance prepared in case of an accident at the side of the track, and obviously felt, Sir Jackie thought this was completely wrong and needed to improve the way that safety was approached in the sport. And the changes that he lobbied for back in the 70s and the 80s are now kind of what we now see as standards in Formula One. He then went on to campaign for dyslexia education. He's a dyslexic and felt like the education that he got wasn't sort of fit for him and the way that he wanted to learn. So he did a lot of work setting up Dyslexia Scotland, a charity that still exists today. And then it was in 2016, after he'd had this really illustrious career and very successful campaigns in his life, that he got the really devastating news that his wife, Helen, who had been at his side since before his motorsport campaign and throughout his entire career, had the diagnosis of frontotemporal dementia. And even though Sir Jackie had had this opportunity to travel the world and had built a huge global network, it wasn't really until this diagnosis came about that he realised that this was not a battle that was easy to fight, and that there was no magic drug, there was no clinical trial for Helen, and as a result, he was just really shocked that there was not more being done within dementia and within this space. So he set up the charity a couple of years later with the aim to identify bold, talented researchers within dementia. And he wanted it to be a global charity, and he wanted it to really push the boundaries and do things differently. So that's very much where the charity is now today. So we are working extremely hard to support research within prevention of dementia, within identifying the disease, and with looking at treatments for dementia. Here's a bit about us. So we fast track Bright Minds to lead the fight against dementia. And as I say, we're tackling prevention, detection, cause and treatment from every angle. And we now have a fellowship scheme that we have been running since 2018. And this latest fellowship is the next evolution of that programme. As I mentioned, it's a global network. So we have Race Against Dementia fellows in the US, in South Africa, in Australia, and in parts of Europe, as well as in the UK. And what was really important to Sir Jackie, and what we will continue now with these UK DRI fellowships, is that it's 5 years of support. He was quite shocked that in research at this stage in the career, that sometimes the tenure of fellowships was less than that. And he was very keen to make sure that there was a really decent amount of time offered in support for these researchers at this earlier stage of their career. And then the other thing that sets us apart perhaps from other fellowships is the training programme that sits alongside the funding. So the training programme is very much drawn from the world that he knows, which of course is Formula One. And he believes that Formula One is a sport that cannot be matched in terms of the way that it approaches problem solving and speed and innovation. And therefore what he does through this charity, and what we work very hard on, is instilling some of those messages from the racetrack, from the behind the scenes in the garages, and imparting that knowledge and the ways of working onto the researchers that we're supporting through our network. So the way that we do this, and this is a shot just from 2 weeks ago when we were based over at Mercedes with some of our current researchers that we're supporting, is that we offer the opportunity to go and visit Formula One type garages and innovation centres. We've just back from a trip with all our researchers to McLaren in Woking. And what we do is we encourage the people that work within these spaces to talk to our researchers and to bring to life some of the messages that make Formula One successful. And what's amazing is that you can very, very much apply those same techniques and those same ideas and values from the racetrack into whatever line of work you're doing. And obviously in this case, we want to do that with the researchers that we're supporting in their dementia research. As well as factory tours, we do sort of deep dive workshops as well. This picture was taken a few weeks ago when we were based at the Dyson Technology Centre in Malmesbury. So as well as looking at the Formula One world, we're also looking at high technology industries and really innovative forward-thinking companies. And this particular day, our researchers were one-on-one with engineers from Dyson that were working across machine learning, artificial intelligence. They were all within the kind of Dyson technology world, but so many of the ways in which they work, but also the technologies that they're using, could be applied to the work that our Race Against Dementia researchers are doing. So that's the sort of opportunities that we're able to offer, and we hope that some of these links continue. And then as well as these sort of bigger groups and these workshops and training sessions, we also offer a mentoring program. So we match our researchers one-on-one with somebody usually from the sort of technology world, so that they have somebody that they can work with while they're working on their 5-year fellowship, that enables them to just think differently or get a different perspective over a problem that they might be facing through their research. So we work hard to match these people up with people from Sir Jackie's network and the network that we've created within Formula One, just to give a completely different opportunity to somebody from the research field. And so far, it's been incredibly successful. One of our researchers has been matched up with a data scientist at McLaren, and the work that he's doing with her has enabled her to fast track her research, in particular around imaging. So looking at her brain scans and tracking movement on those brain scans. And he's been able to not only support her with that, but also allow her to speed up the analysis of those scans through this partnership and through the technology and the sort of programs that he's using every day at McLaren. So just a quote from Sir Jackie, and this really sums up why we'll just go forward just why we're doing what we do. And this is very much what he believes, and where our philosophy sort of shines through into this world, is that in Formula One, when there's a problem, and you still experience it even when Jackie was racing, but even up until now, if there's a problem in a qualifier, it has to be fixed and it has to be resolved quickly. And so Race Against Dementia is all about putting that problem-solving mentality and applying it to medical research. And that's exactly what we're trying to do with these new fellowships, moving forward with that problem-solving mentality, but also the use of technology and how technology can play a role to speed up the progress that's being made within dementia research. Just a little bit about the sort of approach that we therefore look for when we are appointing our researchers. So I suppose it's come across perhaps in some of what I've been talking about, but we do very much encourage that disruptive approach. And we're particularly excited by the idea of applications from outside of the medical profession, and where perhaps skills within data science, computer science and engineering can then be put into the world of neurodegenerative diseases, and therefore those skills can be transferred across into something that we believe is a very important problem to solve. As mentioned, we really want to encourage applications where there's a clear integration of technology, and really pushing boundaries as to how you can access new technologies and find ways to solve problems through speeding up through the use of technology. And Natalie will come on to talk a little bit more about it, but obviously very much the drive of these fellowships and the reason that we have partnered on this scheme is because I think both organisations are very keen and excited by the opportunity of leveraging artificial intelligence, machine learning and data sets into the work that's being done within this collection of diseases. And therefore, we're very much interested in those sorts of applications that are coming through. So yeah, that's me for now. Just to thank obviously Adam for promoting our scheme as always. He's a huge supporter of Race Against Dementia, and I'll pass back to Adam so you can hear a little bit more about the programme.
Thank you very much, Lydia. Honestly, I think Race Against Dementia has done amazing work. I think from the outset, your idea of kind of taking that Formula One mindset has been so successful. How many fellows are there currently in RAD?
So we're now at 21 fellows, but we also have other research programs. So we have 65 researchers on our books effectively, because we're running 3 different research programs now. But yes, the scheme has continued to grow. And as I say, not just in the UK, but internationally. And I think that's one of the big benefits that our researchers feel from being part of it, is it creates this global network of fellows, of researchers who are connected to the charity. And then that in itself, there's a huge advantage to being able to connect up these people and their work across the globe.
And everybody who's had the benefit of joining the RAD program so far has been incredibly successful, haven't they? I mean, these are people that joined the fellowship program quite often soon after their PhDs have gone on to already have leadership roles in their organizations and attract some big funding. So it really is an incredible fellowship program that you bring. And your events you mentioned there, I had the benefit of coming to your event at the Formula One Technology Centre a few weeks ago, where you had Adrian Newey come and give a talk, which is a massive coup. Anybody who's a big fan of Formula One will know what a kind of superstar Adrian Newey is there to get Adrian, and of course many other people there. How do you create those connections? Is this through through Sir Jackie and the family, and through your wider work?
I mean, yes, we are very lucky. They call Adrian Newey the godfather, or the car whisperer or something. So yeah, he's very much a huge talent within Formula One, and the success story behind Red Bull's dominance prior to McLaren's new dominance. So yeah, we were very lucky to get him. He doesn't speak very often. We do have obviously the network of Sir Jackie, and also his son Mark is our chair of trustees and very well connected into Formula One and hugely passionate about the charity. I think everybody who's involved in Race Against Dementia would say it's definitely a family affair, because Sir Jackie is still very much involved, and his 2 sons, and obviously with the motivation of Lady Stewart, Sir Jackie's wife. We are very lucky with the people that we bring together, but we obviously also work hard to build these connections. And what's amazing is that there are so many people within Formula One that will give up their time, they will give up their expertise. Tragically, so many people nowadays are affected directly by some dementia within the family or within close support networks. And so it is, we are able to leverage these contacts, but I also think that people are really keen to help. And
Absolutely.
if we make those connections happen, and something that they say about the world of Formula One that triggers something within a scientist that just changes the course of their research, then that's them doing their part, and I think they get a huge amount of pleasure out of supporting the charity.
And it makes complete sense that you've been looking to leverage AI, of course, and machine learning and data, which is so important in Formula One and in motorsport these days, as they try to eke out all those little bits of improvements that you can deliver. Thank you very much, Lydia. This has been brilliant. I'm going to bring on Natalie now, who's been very patiently waiting. Hi, Natalie. So, Natalie, you're going to run us through and give us an overview of the fellowship program now and the detail of it and how people can apply. Thank you, Lydia. And I'll hand over to you oh, wait a second. Before we do that, we've got another film to show you. We're gonna give you some background to start with on the UK DRI for those that aren't.
So a question I'm often asked is, why is it after decades and billions of dollars of research do we not have effective treatments for the dementias? And the reason is simple. We simply do not yet understand the workings of the brain in sufficient detail in health, never mind in disease. The brain is the most complicated organ in the human body by a country mile. We're 2-3 decades behind other areas of medicine in therapeutics. Now that's changing because of major advances in scientific know-how, knowledge and approaches. The challenge for us as a nation is to better understand this and begin to deliver therapies that will improve the outcomes for people living with dementia or at risk of dementia. And that's the absolute mission of the UK Dementia Research Institute. In order to get there, we have to better understand the underlying biology causes of these devastating disorders. We need to take those medicines into clinical trials, and we do that by working in partnership with other major organisations in this country, which are anchored around the NHS. In parallel to that journey of discovery through to delivery, we need to also improve our diagnostics. We're already doing that through the DRI, through, for example, the biomarker factory, where we're this close now to having blood tests that can make the diagnosis with a high degree of predictive accuracy. That is light years away from where we were just a few years back. So I'm optimistic for the future, but we should be in no doubt that if we want the breakthroughs that people need, which are new treatments, we have to first understand the fundamental biology of the disease. And that takes time and that takes investment. And that's the role of the DRI.
Some inspiring words from Siddharthan there, but that's we'll hand over to Natalie now, who's going to talk us through the fellowship.
Fab. Thank you, Adam, and thank you, Lydia, for your brilliant introduction to Race Against Dementia. As Adam mentioned, I'm a science programme manager at the UK DRI, and my role includes looking after the funding opportunities we have, both internally and with amazing organisations such as Race Against Dementia. At the UK DRI, our goal through research is to transform the lives of people affected by dementia and other related neurodegenerative conditions. The UK DRI is building a future where we will be able to predict an individual's risk of dementia before symptoms appear, prevent the onset of neurodegenerative conditions, and personalise the care and treatment of every individual affected by dementia. Our work as the UK's leading Research Institute for Dementia and related neurodegenerative conditions is data-driven, collaborative and team-based. And together we work to target discoveries that will lead to more effective therapies and a better quality of life. As an institute, we achieve this through 3 linked pillars of research activity. So discover what causes dementia, developing new tools, tests and treatments, delivering solutions to maintain brain health in an ageing society. And as mentioned by Siddharthan, our unique strength lies in our comprehensive approach, bridging the gap between scientific inquiry and therapeutic innovation. And we need to collaborate to be effective. So we partner with outstanding research teams across the globe, in universities, business, tech, and the NHS to optimise progress. And it's great to work with organisations as forward-thinking as Race Against Dementia in this pursuit. Ultimately, we straddle research from lab bench to bedside and back again. And people living with dementia are at the heart of research, discovery, development, and the delivery journey. The UK DRI is made up of over 1,000 members based at 6 leading UK universities, which host 9 research centres. The UK DRI community is made up of over 80 group and emerging leaders who have been awarded a range of prestigious prizes recognising their scientific excellence. And all of these centres are also supported by a core team based in London. The UK DRI's core team is the central hub of the Institute, coordinating resources and providing operational and strategic support to the UK DRI's 9 centres. This includes running funding rounds, hosting research events, liaising with industry partners, all the way through to engaging with government to change policy. And additionally, within that core team, we have a dedicated innovation and business team, which support translation and commercialisation of activities developed through the DRI. This might be identifying IP, spin-out formation, early stage clinical trials, amongst other things. But this isn't just drug development. So it may be supporting researchers to commercialise protocols, biomarkers, algorithms, and new technologies. So as an institute with over 1,000 members, we do have a broad range of research within the community. The majority of our portfolio is focused on Alzheimer's disease, but the reality is that researchers work across multiple neurodegenerative conditions in collaboration. And by working across a diverse range of neurodegenerative conditions, our researchers ultimately are then using and developing new tools and technologies which can transform through research the lives of individuals at risk or living with neurodegenerative conditions. And to best do this, the UK DRI looks to bring together diverse minds and approaches. Echoing Race Against Dementia, there is strength in promoting disruptive approaches. Over 40% of the UK DRI community has been recruited from outside the dementia research field. So bringing in different viewpoints and techniques to think about problems and to address some of research's toughest questions is one of our strengths, and we're looking to grow that community. We're also incredibly supportive of early career researchers, with 1/3 of our group and emerging leaders establishing their first independent lab when they joined the UK DRI. Additionally, although we are labelled as the UK DRI, our institute truly is global, with 1/3 of our academics joining us from overseas settings. And we look to equip our researchers with the resources they need to perform cutting-edge science. We have a number of centrally supportive strategic platforms and technologies available to our community, designed to help you take your research to the next level. Some of those are listed here. We have a portal which includes lots of information for those new to the DRI about access to these technologies, how to identify labs to provide support, or to collaborate on technology types or equipment. So moving on to the fellowship scheme. We are absolutely delighted to be pairing with Race Against Dementia for this call. It's such an exciting opportunity to support the next generation of researchers, to drive pioneering high-impact research, to build global collaborations, and to transform the lives of those affected by dementia and related conditions through the use of the latest advancements in AI technology. We appreciate that dementia is an umbrella term under which fall a number of progressive conditions. Alzheimer's is the most common, but proposals looking to advance our understanding of dementia that results from other conditions would certainly be within remit for this funding call. As Lydia mentioned, we are really looking for proposals which have a disruptive approach. So applications that take a different angle on a research question. Maybe you're going to use existing techniques, but apply them in a different way, or bring new technologies and approaches in to tackle difficult questions related to dementia research. A key element of this call is leveraging AI approaches, and we're not just looking for standard approaches. So it's all about thinking differently about how you can leverage the power of AI and use it in a responsible way to provide a real stepwise change in our understanding of dementia. So this may be through investigating disease mechanisms, identifying biomarkers or risk factors, discovering means to improve diagnosis and treatment of those living with dementia. Projects which are solely focused on patient care-based initiatives would be outside of the scope of this call. It may be, as an applicant, you want to develop brand new de novo AI approaches, but applicants may also be looking to bring together and refining existing AI approaches to apply them in a different way that's not been done before to answer a research question. For example, this may be the application of machine learning algorithms to extract information from large data sets. But the important thing is to, within your application, describe why this approach will be transformative. So how is it better than what can be done already? And how will it really provide that step change in our understanding of dementia? When thinking about your AI approach, a whole range of different techniques encompassed under that AI term. So it could be natural language processing, machine learning, using neural networks, or it could be a combination of a number of these approaches. So these fellowships are aimed at individuals with up to 6 years post-PhD experience, but there is a degree of flexibility here for those of you who may have had a non-linear career path. So that might have been a period of time in industry or in clinical training or pursuing something else entirely, and now you're coming back into research. We're really happy to discuss any queries you may have around eligibility and encourage anybody to get in contact with us to arrange a call after this webinar. Additionally, if you've not yet been awarded your PhD, this doesn't necessarily mean that you're not going to be a competitive candidate. It may well be that you've got other experiences that make you an excellent individual to be leading a fellowship. You don't need to have, you need to have been awarded your PhD before the fellowship would start, but not at the point of application. This call is also open to individuals outside of the DRI currently. So if you're not already based at a UK DRI centre at the time of your application, you will need to identify a centre to host you during your fellowship. They will also be able to support you with preparing your costings and all of those other important things that go into an application. We really do welcome applications from women, those with disabilities, members of underrepresented groups, ethnic minorities, and other groups currently underrepresented at a senior level within the research community. When you're thinking about your sponsor, this will be the person who will host you within their lab. So they will be providing you with access to facilities to undertake the project, as well as providing advice and guidance to you. So the research you propose should be distinct from that of your sponsor, but we understand it's likely to be complementary to the work going on in their lab. But what's really important is to demonstrate that you have ownership of the project and that you're the one driving the research forward. If the project you're looking to do is multidisciplinary, which we would really encourage, it may be relevant for you to identify more than one sponsor to support you to complete the project, particularly if it includes new approaches, which you will need to be learning during the fellowship. We do have full and comprehensive guidance around the scheme available on the DRI website, and there is a link also on Dementia Researcher. Race Against Dementia and the UK DRI strongly encourage incorporation of secondments within the fellowship period. So these may be for up to 24 months, but this doesn't need to be in one continuous period. So it could be short research visits that take place over the whole time frame of the fellowship. These secondments could be international, they could be at another university, at a company, at pharma, or in a sector outside of science. We really suggest that you think carefully about the benefits of a secondment period, the skills you want to learn, and how this opportunity can help you grow your professional networks, as well as supporting you to deliver the fellowship. Equally, thinking about collaborations and choosing the right collaborations can be really beneficial in an application. So we welcome the inclusion of collaborators or industrial partners. These collaborators may be providing financial or in-kind contributions. They may be directly to the project, such as access to reagents, tissue, data, software, but they may also be providing access to training for the applicant, which in turn supports their career development. So for any collaborations or in-kind industrial partnerships that you're looking to name within your application, it's really important that you include letters of support from those organisations detailing what they're going to be providing you. And as well as being about transformative dementia research, these fellowships are just as much about the individual and their development. So within any application, it's really important to demonstrate the skills and the training that you will be developing and gaining through this fellowship, and how at the point of completion of the fellowship, you'll be in a position to establish yourself as an independent researcher driving change in this field. So thinking about duration and finances and things like that. These fellowships are for either 4 or 5 years. This is fixed, so we're not looking at 4.5 years, 4 years, 3 months, or anything like that. It's a 4 or a 5-year award. And the fellowship is for up to £500,000 for either duration. And within that £500,000 should be overhead costs included. You can include costs for salary, consumables, equipment, secondment related costs and travel and things like that. I would always advise applicants to take care with costings. Cheaper isn't always better or more attractive to fund. The panel really want to see you've carefully considered your approach and you've costed it accordingly. So it's difficult, but try to consider ensuring that you account for any additional experimental repeats or troubleshooting you might need to do. So it's always safer to have a really well-rounded finance side of that project rather than risking an underestimate or over-exaggerating the costs that you require to complete the research. Ensure the salary that you're putting on there is well justified. Receive guidance from the centre that you're going to be undertaking the project at. And as I mentioned in the collaborations, if you're receiving any match funding from the university, whether that's financial or in kind, maybe the university is also providing you with a studentship to help you alongside the fellowship, or they are providing you with a piece of equipment. Make sure you highlight that in your application. You're demonstrating there that you're good value for money. And we also have some training included from the UK DRI side. So this has been designed to complement the brilliant training plans available through Race Against Dementia. We want to ensure that fellows have robust training in lab management, statistics, and communication skills, but we're not being prescriptive on what courses we want fellows to take. We want the fellows to identify the best fitting course because they know their skill level and what they want to learn and how they can excel. And post-award, we will look to cover costs for attending these things separately. So coming on to our assessment process, the important thing to note is the call will close on the 4th of December. So at this point, applications will go for panel review. And applications which progress through this stage then go to review by a panel with lived experience. Shortlisted applicants then receive feedback both from that initial panel review and from the panel with lived experience. We don't have a written rebuttal stage within this process because we want to speed it up and not make it take even longer than it needs to. But the applicant will have the opportunity to address any comments, any feedback they've received at the interview stage. Funding recommendations will be made in March and fellowships can start straight away. And finally, just to flag those timelines again, deadline is 4th of December. Applications will need to be made through the UK DRI Salesforce platform. If you're currently external to DRI, please use the awards mailbox address listed there to contact us and we will set you up an account. I know Adam mentioned this earlier, but there will be finance offices at universities and they will have timeframes and deadlines that they want to process applications through. And 4th of December, we'll be heading towards the Christmas closures for universities. So it's never too early to flag to the university that you're looking to hold the fellowship at, that you want to submit something for the course. They can make sure they can process your costings in time. Full applicant guidance is available on our website, but if you have any questions or queries, please put them in the chat now or send us an email and we're happy to arrange a call or get back to you if something pops up to you after today's webinar. Thanks.
Thank you very much, Natalie. That's really helpful and comprehensive. I think you've already answered some of the questions that I've been sent in advance. Just a reminder to anybody watching, you can post your questions at any time using the chat button there, which I'm also I think is already enabled on YouTube, but I'm gonna enable it now anyway. I do have some questions though that have been sent in advance and we've got a few already from the audience. So here we go. Are you sitting comfortably? We'll work through them. AI is a broad field. How will the panel balance highly technical AI proposals against those with stronger biological or clinical grounding?
Starting off with an easy question there, Adam. No, to answer that question, that relies on the quality of the experts that we have on our panel. So we are finalising the panel arrangements now, and we will have a panel that has strong AI expertise in the dementia field. But we're also looking to have quite a diverse panel. So panels with experts from industry and other sectors that are very well versed in the application of AI in different spaces. And any application would be assessed by multiple panel members that will hopefully match, the topics that are being portrayed in the application. So a specialist in the AI approaches and in the dementia side of things. So they will come together to provide a review for that applicant. If we have applications come in that we don't feel we've got panel members with the right expertise, we would look to co-opt additional panel members to ensure a really robust review takes place.
Which actually leads me very nicely into the next question, which is, will proposals that take risks with novel AI approaches, but with less preliminary data, be viewed positively or cautiously?
I think that ultimately comes down to the contingency strategies that you have within your application. So if it's a new AI approach that you're looking to do for the first time yourself, that obviously has a risk element included within it. So it's looking at, what are your backup options if there are issues with that? Have you got the right individuals to provide you with support should you encounter problems yourself in developing the code or tool? But equally, if once you've developed the code, it's now unable to answer your question the way you thought it would, what is your stop point? So thinking carefully about, what are your indicative measures of success that then flag now's the time to switch to a different approach to be able to answer this question. There's always a balance there between high risk. The nature of these fellowships with the duration gives you the ability to be a bit more high risk because you've got that 4 or 5 years. So there will be stop and go parts during any fellowship, but with the duration gives you a little bit of a buffer to try things that are a bit more high risk. We do want to see things that are different. We're not looking for like standard recycled grant applications that have come from elsewhere. We want to support approaches that are innovative. I think it's always about carefully thinking how you can manage the risks and what support you have in place to mitigate that it doesn't end up being 4 years into the 5-year fellowship and you're struggling to get data, and thinking about it ahead of time. Also, like having a really good sponsor, that can help you discuss the progress of your project as you go along to ensure, you're having discussions with people in the community about when to move on or change or adapt your approach.
And can you tell that these 3 questions all came from the same person? Because the next one is, how is impact defined in the context of AI research? Is this about immediate patient benefit, new algorithms, or methodological advances that may take quite a long time to translate?
I think what's really important there is we understand that research may take time to have an impact, but I think what we are looking for applicants to articulate is that they have sight of what that impact will be, and an understanding of that may be 5 years in the future, it may be longer than that, it may be more short term, but they have an idea of when that impact will happen. Because ultimately our aim is to impact the lives of individuals living with and at risk of dementia. So it's always key to tie any project to the fact that these are people that we are ultimately at the end of the day that we want to have a transformative impact upon. I don't know, Lydia, there's anything
No, I
else
think you've answered I think you've asked the question.
And
Right, let's go.
Can I one point on there, Adam, just around
Sorry, of course, Lydia.
measurement for us as a charity is obviously the use of technology to speed up what would have taken a long time. And Siddharthan in that video said, we're 2 to 3 decades behind some other diseases. And as an organisation, we find that very difficult to come to terms with. But one benefit to living in 2025 is it's not hopefully going to take us 2 to 3 decades to catch up, because we have the benefit of the world that we live in and the technological advancements that have been made over the last few years. So for us, a success measure within the scheme is being able to demonstrate how technology and AI has allowed you to do something a lot quicker that otherwise would have been a slow process or taken a lot more resource or a higher cost. So we definitely look for those sorts of efficiencies that are identified by the researcher.
Yeah. Shall we go? We've got quite a few audience questions stacking up now, so I'm gonna jump to those, and we'll come back to the pre-submitted questions afterwards. We had one quite early on where somebody asked, I'll pop it up on the screen, is Parkinson's included in the fellowship remit?
Yes, that would fall under our dementia umbrella, research in that space.
That was an easy one. Here we've got another one, which is, how can I apply for this fellowship? I've submitted my PhD in 2019, now running a lab in India working on dementia.
I mean, I suppose the first steps it would be to identify researchers in the UK that would potentially be your sponsor. We would require the fellow to hold the position at a UK DRI centre, so they wouldn't be able to hold the fellowship and continue to be based in India. They would have to come to the UK for the duration of the fellowship. So the first port of call is to find a sponsor that aligns with the research project that you want to do and to go from there. Any individual questions around eligibility and personal situations like that, we're really happy to answer over email or on a call.
I think this came up as part of your talk, but for applicants not in the UK DRI centre at the moment, am I right in understanding? So what are the expectations about relocating in physical presence? Is that a physical presence essentially for the full duration into a DRI centre?
Yes, I mean, it could be, depending on where you are at the moment, that you move to, let's say, Imperial, the DRI Centre at Imperial, and you're originally in Manchester, but it's a continued collaboration with a group at Manchester, and you spend some time back there learning things, bring it to the DRI Centre, or vice versa. But ultimately, we would look for individuals to be hosted within the DRI centre. But if it was still relevant to continue a collaboration with where you were previously, that would be fine. Equally, if you are based at a university, if you're based again at Imperial but not within the DRI centre, you don't have to move to a different DRI centre to be eligible for the fellowship. Ultimately, you need to be at the best place to be doing that research that's going to have the most supportive environment, the right sponsor for you to make that project and yourself really successful.
For those that don't already have a connection or a network that involves a kind of DRI sponsor, is there any support available to kind of make that? Have you already potentially had some people within some of the centres come forward and volunteer their services, or is there a way of facilitating some connection?
I mean, if you're completely new to the DRI, I suggest the first thing you do is have a look on our website. We've got kind of all of our researchers listed there and the kind of key techniques and things that they're involved with. They're very happy. Our group leaders, emerging leaders, are really happy for you to email them to start up discussions around applying for a fellowship. Equally, if you would like us as the core team to do those introductions, we're very happy to make that first step for anybody.
Fantastic. Let's go to another audience question now. Here we go. Can we have some more information on the secondment? Is it recommended to have several days a week at a collaborator in tech or academia, or a large continuous stretch of maybe a year or something?
I think that ultimately depends on the project that you're looking to do and what will really benefit you as an individual and the project. We appreciate that some people may not want to or be able to relocate for months at a time, at another university in another country or a tech company abroad. And it may be that it's a couple of days a week that they're having, time at their secondment host. But it's thinking about what you're trying to achieve with that secondment period. It's not a secondment for the sake of it. It's thinking about what you're trying to gain in terms of, furthering the development of the project, the skills you want to learn. You know, do you need to be there for 3 months to really immerse yourself in the technology, the skills to pick up how to do it, to take it back to your DRI centre? And within the fellowship, you can include costs for the secondment. So, you know, any additional travel costs or visa costs that are required for you to go abroad, let's say, for a period of time. It's not one size approach fits all. It's kind of what will work best for you.
We've got a kind of secondments follow-up question, which I'll bring in now as we're talking about secondments. It can be hard to have one booked in for a couple of years away in advance, even if you are keen to include one. Can, at the point of application, you just be tentatively suggesting where you'd like to go rather than actually know exactly where you'd go and what you'd do?
Yeah, definitely. We appreciate that science is moving quicker and quicker, and you might go to a conference and meet people, and then, you know, you've already submitted your application, but suddenly a really exciting secondment opportunity comes up. And I know UK DRI and RAD are really keen to continue to support secondments if the opportunity should pop up later during the fellowship. If you've got kind of a tentative secondment in mind at the time of application, we suggest that you include it. And if possible, a letter of support from whoever would be your contact at that secondment, to show that they're keen on supporting you. Equally, we know that things don't always work out. You know, science is not a linear path. Things take different directions. There's, you know, different things are of interest. Things don't work as well as we would have liked, and an original secondment idea may not be the best fit for you 3 years down the line of the fellowship. If people are in those kind of situations, what we say is our door is always open. We want to support you. So come to us, discuss it, and we will look to support you in whichever way we can. Ultimately, you know, your success is our success. So we want to provide help where possible.
Yeah,
Great.
echo flexibility point of the fellowship, and equally, you know, being introduced to a network of people from industry and also a global network of researchers who you perhaps haven't otherwise worked with. You know, opportunities will come up, and we almost encourage those opportunities to come up. So I think flexibility being key, you know, from both Race Against Dementia and the UK DRI side.
Do you have anybody from your end, Lydia, that because obviously you've mentioned already that you have somebody from McLaren, for example, who works in machine learning and in that space, working with Cara, who's been on the live stream before and on our podcast before. Do you have connections that you're keen to exploit as well?
Yeah, absolutely. And this fellowship's been a really good talking point for us to go to some of these industries that are interested in this side of what they're doing. I mentioned Dyson earlier. You know, you really don't know until you start putting these researchers in front of these people from tech and engineering where the collaborations can come from. And even an industry that, you know, has traditionally made vacuum cleaners, actually the expertise within that organization are very, very transferable. But also what's so nice is that all these people are so keen to be involved and impart their knowledge. So we have 2 or 3 different companies that we're speaking to at the moment about this particular fellowship, potentially to come on board with mentoring, or, yeah, as I say, you know, potential secondments or research collaborations in the future. So very much that's our ambition.
Wonderful. All right, our questions are stacking up. I'm going to come through them. The next one says, could you also say whether costing for external training is permissible? Example, if there's a world leading course for a specific deep learning or architecture, for example.
Yes, the short answer to that. Yeah, if there's a course that you've identified at the point of application that you know will really help you in that fellowship, you can definitely include the costs within that 500k.
Which leads me actually to one of our pre-submitted question, which is AI research requires access to large, high-quality data sets. Will fellows receive structured support from the UK DRI for data access, governance and computational resources?
That slightly depends on what the project is, but we do have a huge data team at the DRI, and we do have access to some big databases, human patient databases, international databases with different kinds of patient data that you can access through the DRI. We do have a data team that provide guidance about best practice in terms of data repositories, storing data, retention, all of those kind of bits and pieces. So it's something, it's a huge area that's constantly evolving. So we are always open to hear kind of what the community needs in terms of support in that space, so that we can best help our researchers. Yeah, because we're producing more and more data in more and more ways, aren't we? It's getting bigger and bigger. So yeah, certainly happy to discuss it.
What about the computational resources? Is there one centre? Because of course we know the DRI spans from Cardiff to UCL, Imperial, Edinburgh, it's all over the country. Are there particular institutions within the DRI that have stronger resources that lend itself to this kind of, if you're looking at heavy on the computational side, is there a centre that you think would suit certain research more than it would others?
I think that's a really hard question to answer, because the different centres have different research that goes on there. But ultimately, as DRI, although we have geographical centres, we've got research divisions that occur across centre. So there's a lot of work going on to, ensure cross-centre collaborations, and that you can visit different centres to learn techniques and share information and things like that. So in terms of, we have a data team, a bioinformatics team that do a lot of work in that space, and they're kind of separate, like within the core team, that then cover everything that goes on within the DRI centres. So I would first of all advise looking carefully at the sponsor that's doing your research, but that sponsor will then be connected to other researchers across the DRI. So, if you realise you need slightly different support, say you're at Imperial, some of the research that's going on there, but they've got collaborators at in Cardiff that can support you, then you could go to Cardiff to get a bit of time there, learn some equipment, access to training, that kind of thing. So although we have the geographic sense of things, we're very much operating across those centres.
That flexibility sounds good. So if you start off by saying, right, clearly I need to go do this piece of work in Cardiff because that's where the sponsor is, but then as time goes on, you realise actually you might be better off splitting your time between Cardiff and Edinburgh or Imperial or UCL or wherever it is, that there's that flexibility to dynamically move within the DRI.
If you know that at the point of application, list a sponsor from Cardiff and a sponsor from Edinburgh on your application that are going to be supporting you to deliver different elements of the project. But as we know, and I mentioned earlier, science doesn't follow one path, and things will crop up along the way. So we're very supportive of trying to encourage that cross-centre collaboration, and not letting geography stand in our way of exciting research developments.
Thank you. Well, just to reassure people who are watching, I'm going to keep Lydia and Natalie over the hour to make sure that we do get through all these questions, because I'm conscious we've only got 3 minutes left. So do stick with us and we'll get through them. This next question was, I was wondering if there's a preference regarding research models for this fellowship, example, human-based or animal disease models.
That really comes down to ensuring that it's the best model to be answering your question. So, we know there are issues with animal-based models. We know there are issues with some human-based models, but it's thinking carefully about the question that you're trying to ask and whether the approach you're using is the most suitable approach to get the answers that you're hoping for. There's obviously a lot of value still in animal-based models. I'd say as an institute, we are very much moving towards human-based approaches wherever possible. But it may be that there's a combination of the two that is the best approach for answering the specific question that you have in mind, whether it's the animal-based models are then informing parts of the human aspects of your question you want to ask later. It's not one or the other necessarily.
Thank you. And if you're interested in the whole discussion about animal versus animal models, we are holding a debate in the Dementia Research Community app on the 15th of October at 12 noon, where Lucia Katsuri and Professor Michael Coleman will be arguing for and against exactly that discussion about whether animal models still have a value. So look in the Dementia Research Community app. Right, that's enough of a plug for my stuff. We'll take our next question, which is, you mentioned dementia care is not in remit, but how about symptom management and treatment approaches?
So again, that comes down to the specifics of the research proposal. care focused projects are out of scope for this call, but treatment, if it's treatment for dementia, that would be within scope for the call. It will come down to the specifics of the question. So if someone is unsure if they're, where they fall within remit or without, I'm very happy to have discussions with anyone about specific research-based questions afterwards. I don't know if Lydia has anything you want to add in that space.
I think that's where it sits. Again, it also comes down to the core of the call, which is that use of technology, and I think it very much depends on the specifics, and if it's an innovative new way of looking at treatment management or whatever, then yeah, that would be worth exploring. But yeah, unfortunately, care sits outside the remit of Race Against Dementia and this particular call.
Thank you. Okay, long question this time. Charis asks, can I clarify the remit, please? Is the remit limited to discover stroke develop, or would interface with delivery be included? I'm interested in developing and applying AI-enabled data-driven methods in prioritizing candidate drugs in vitro.
Yes, I'm trying to understand the question fully.
Yeah.
But yes, if you're looking at kind of drug screening for what would be a suitable candidate, repurposing drugs on, new drug candidates, that would be within remit for the call. It falls under the treatment element that we were talking about.
Great. I'm going to take one of my questions I had here. Where is it? For international applicants, how much support is provided around visas, relocation costs, and settling into the DRI environment?
So you're able to include visa costs on your fellowship application. The DRI is listed on the UK DRI approved organisation list, so you're suitable for a global fast track visa in that space. So that would include visas for you as the individual and, if applicable, for your family members. And I would advise contacting your local centre that you're looking to hold the fellowship at for the specifics around support in applying for that process, because we appreciate that's taking a while at the moment. In terms of settling into the DRI, we have induction kind of events and things like that, and we do kind of have research events that go along across the centres, and we have an annual conference actually as well, Connecting, where we bring together as many of our researchers as possible to network, to share advances, and hopefully lead to collaborations and things like that.
Great.
And the same would be said on the Race Against Dementia training programme side. So we get together virtually every 2 months, and then once a year there's a week-long training course as well, which has just happened a couple of weeks ago. So it tends to be in September. So again, bringing the individuals into the fold so that they can meet other people who are part of the Race Against Dementia programme. Sounds like it leads well into the next
preempted that question there. Well done. There was another question on that. Can fellows continue to collaborate actively within their current groups outside the DRI? Or is the expectation that they will embed fully within the host centre?
Sorry, Adam, I missed the start of that. Would you mind saying it again?
Can fellows continue to collaborate actively within the current groups outside the DRI, or is the expectation that they'll be fully embedded within the host? So I guess if you're already somewhere else out in the UK doing this kind of work, can you vie your time between your current, placement?
Yeah, I mean, if the continuation of that collaboration was important to the delivery of the fellowship, we would certainly be supportive of, continuing to have some time at that other institution. I think ultimately we would like researchers to become embedded within the DRI community, but we recognise that although the DRI is 1,000 people, networks are broader than that, and our strength is in diversity inside the DRI and outside the DRI. So if you can demonstrate the value of that collaboration and the time you wish to dedicate to continuing that during the fellowship, then that would be perfectly fine.
I suppose that's relevant as well. If you've got a family, for example, at the moment, and the concept of moving, completely relocating for your fellowship wasn't, so you want the fellowship, but you don't want to have to move across the country.
Also that's a really good point, Adam, that I didn't mention. These fellowships can be undertaken part-time, maximum of 0.5 FTE, but if that suits with, maybe you're in clinical practice and you want to spend half your time working on this fellowship, or if you have family elsewhere or other commitments, these fellowships can be taken up to 0.5 FTE and extended for the reciprocal duration.
That's great. That's really helpful. I think that is a good point to help people with families or people returning to work. As you mentioned at the start, you're keen to encourage people from non-traditional backgrounds in this space to potentially come and apply as well.
Yeah, definitely.
Which actually raises another question that I was thinking of, because you have to have a PhD though. Because from my understanding of this, that some of the people perhaps who are a bit heavier into the engineering side, who haven't come from a dementia background, might not actually have a PhD, but do have massive experience in AI. I mean, should those people at least come and have a conversation, or would they not be eligible?
They would fall out of the eligibility for this call, but we'd be very happy to have a discussion. We are constantly looking at reviewing the funding that we offer and where we can meet the needs of the community. And we do want to improve our relationships across sector, so outside of the typical bioscience sector, and thinking about tech and big tech firms and other ways of operating. So we'd be very happy to have a discussion if there's interest in this call, but you don't have a PhD or wouldn't have one at the time of award. We still want to hear from that community, because if there isn't something out there that meets your needs, maybe there are other discussions we can have, find something else later down the line.
Thank you. All right, let's take another question here. I think we might have answered this one. Just to clarify about the host, does the PI need to be in a DRI centre, example DRI at UCL, or is it okay for the PI to be an institute where there is a DRI but not necessarily the DRI? That is a good question.
So the PI would need to be a DRI member. So they would need to be a group leader or an emerging leader within the DRI. They should have a contract that would outlast the duration of the fellowship. If they don't, we ask that you include more than one sponsor, so that you do have someone that outlasts the duration of the fellowship. We want to ensure there's someone there that to provide you with support for the full duration of the fellowship position. But they do need to be a DRI group leader or emerging leader.
That's been a tricky point, hasn't it, in the past, with a 4-year fellowship? Trying to find a sponsor that's actually got longer than you're going to get can be quite tricky. So you probably do need to look for more than one with the nature of short-term funding in academia. Right, let's take another question. We've got this one. Tim asks, for the stated integration of technology aspect that is emphasized, please could you elaborate on this or give examples? Would this include example lab methods that are recently developed / high tech?
In theory, yes, this could include lab methods that are much more high tech if they are increasing throughput, enabling more data to be gained from tissue slices, from cells, from whatever. That could potentially be within remit. Again, I think it's one of those things, if it's a very project-specific question, they're easier to discuss one-to-one to understand kind of the thinking behind the project you're doing, so I can provide a bit more advice in that space.
Great. Next question is this one, which is, I'm interested in developing and applying AI-enabled data-driven methods in priority. Oh, have we already had that? Or I think we might have already answered that question.
Or a very similar one, but yes, yes, it would be within remit.
The answer is yes. And then we have another one, which is, should we include open access publishing costs, or are these separate funds? The same goes actually. I had a question in my list here, which is, should they include costs for accessing data sets? Because of course, particularly in big data, in this big data space, that can be quite expensive. Even just accessing data from Biobank or from, say the Dementias Platform UK and things.
Yep. So through the DRI and some of the platforms that we have available to us, we have access to things like the SAIL database, some biobank data sets, and things like that. So that would be covered through core costs of the DRI. It may be that there is an additional data set that you want access to that is not part of our system already. And in that case, either discuss it with us and I can tell if it's something that's kind of on the pipeline to be sorted out, or if it's something that's very unique, and then I would suggest including costs for it on the proposal. In terms of APCs, no, you don't need to include costs for APCs. The UK DRI falls under the umbrella of a core MRC funded institute, and they provide the block grant that UKRI has, so the APCs would be included under that.
Great. Well, this is anybody watching live. This is your very last chance to put a question in the chat now. I do have a couple more from the pre-submitted questions, but Natalie, if people are watching this on the recorded, and Lydia, how can people get answers to their questions if they've missed this live today?
Contact us on the awards mailbox. So that's awards@ukdri.ac.uk.
Wonderful. And sorry,
and then
Lydia.
anything that's relevant to us will either be passed on, or info@raceagainstdementia.com is our address.
Brilliant. So my last couple of questions here, I think actually I'm just running through and crossing them off because I think we've addressed most of them. We did have, what if you already hold a fellowship? Hold a fellowship at the time when this is applying. Are you okay with them holding more than one?
Well, a fellowship ultimately is awarded to the individual to pay their salary for a duration. So if that fellowship would be coming to an end and this one would then be, a new project, and there isn't a time-wise overlap, we don't want to be double funding an individual, that would be suitable. I think we would want the applicant to demonstrate how this second fellowship was going to be, provide them with a pivotal change that makes them a highly competitive individual moving forward and will make them a world leader in that space. It's thinking about what this fellowship will provide them that maybe they didn't get through the fellowship, or what the difference between the two awards are. If that was very much a less than 2 years PhD experience fellowship, you've got your own independent money, that's fantastic, shows that you're driving a project forward. But then does this fellowship then give you that duration, the access to collaborations, you've now got a lot of experience under your belt that you are confident you can deliver on the project. So it's showing what you've learned from the first one and how this could further build your career.
I think in the past we've certainly had, I know Ian Harrison talks to this very well from UCL about how he applied for 2 and got them both, and then managed to negotiate that this was kind of that the salary was shared and that you could split your time. So I guess people do make it work if as you say it's conducive to the work and you can justify why you do it. We did get another question here, although this is how if the applicant already has a postdoc currently. I'm assuming you can just apply. That doesn't make any difference. Just apply. I don't think my questions, there was one here. How much weight will the panel place on the strength of the applicant sponsor relationship if the partnership is very new?
I think some of that will come out in the letter of support from the sponsor. So we want to see that the sponsor is invested in you and that, they've seen the value in that collaboration. We know some of these collaborations will be new, particularly if you're outside of the DRI already. But it's important to demonstrate in that letter that this is not kind of a cold calling sponsorship, but you've discussed the project, you've got together with and to talk about how you can deliver the project with their support, and how they will continue to guide you and support you throughout the duration of the fellowship. So a panel can really easily detect something that's not a true connection between a sponsor and an applicant, and they can also very easily detect a recycled application. So think carefully about tailoring it to the call and investing some time in developing that sponsor fellow network at the point of application. New doesn't mean a problem, but show that they're keen and they want to support you.
That's good. My very last 2 questions. How does the fellowship position ECRs for transition into leadership roles in AI and dementia? Are there structured pathways to go on to become a group leader?
So that's a really good question, and it's an evolving discussion that's happening at the DRI at the moment. I mean, I think we're certainly, with a lot of the leadership training that is available through Race Against Dementia, and the training available from the DRI, we are, looking to upskill those fellows to become the leaders of tomorrow. But I honestly can't speak for 5 years' time that there will be a group leader position available. There may well be, but that's an evolving discussion happening at our end, and across the whole of academia in the UK, really, isn't it?
And Rad, you've got a great reputation with this. I think there are very few of your previous fellows that haven't gone on to be group leaders so far.
Yeah, I think that's right. I think there's just around the scheme and the training that is given, and the network that is created through being part of the Race Against Dementia programs, just allows people to, progress their career and feel confident to go and apply for those future opportunities. Dr. Viola Zellick down in Cardiff has just been awarded a Future Leaders Fellowship for the next 7 years. Things like that. They're building confidence in people that they can go for these things and that they can put in strong applications, is absolutely within our philosophy, but also recognizing that not everybody just wants to become a group leader. We have some fellows that actually have found their skills are really valuable within what they do, and they are very keen to stay within, in some cases, data. We have a brilliant data scientist who's just been able to evolve her career within that space rather than a leadership role. So I also think it's I hope what you get from this, and from what Natalie said and from what I've said, is that the scheme is very personal, and because it's still quite small, we can kind of give that support to the people that are part of the program, and that we offer the flexibility, when opportunities come up, and whether we help you get them or whether you go out and get them yourselves. So yeah, that's kind of the sentiment of what we're trying to do. And sometimes we can't answer all these questions so directly, but if they come up as part of the program, then we're here to with the UK DRI to support the recipients of these fellowships.
Absolutely. And the very, very last question. Given AI moves faster than traditional grant cycles, how flexible is the scheme in adapting projects to emerging methods or tools that weren't available even at the time you apply?
Again, flexibility and moving forward. I think if that happens, then that's brilliant, and that's exactly what we want to achieve from the scheme. That that we're in a position in 2, 3 years, 4 years time where the world looks very different, and as a result, dementia research is moving with the times.
Yeah, I mean, if things change substantially, we're very open, and we want to follow, not in an onerous way, but we want to follow your progress throughout the fellowship so we can ensure you've got the right support. So if there is a huge change in the project, share it with us so we can flag it to our innovation and business team or to other people within the DRI to kind of alert them that it's really exciting and they can get involved too, or that you need different support now than maybe you did at the first point of application. But as Lydia says, it is a fast emerging field, and we want to be adaptive in our response.
Thank you very much. We've gone 16 minutes over our allotted time, but it was really important, I think, to get through those questions. So I'm really pleased. Hopefully we answered to your satisfaction. We did run a poll at the very start of this on YouTube, and 79% of the people that attended said that they intended to apply. So good luck with your applications, and do make sure you make those connections to the DRI teams to early. Don't delay this, particularly with the finance element, which is going to take some time to work out as we lead up to Christmas, as Natalie alluded to. Thank you very much to the incredible Dr. Natalie Duggett and the amazing Lydia Beaton, and of course to Race Against Dementia, who are one of our brilliant sponsors for Dementia Researcher, without which none of the work we do at Dementia Researcher will be possible. So we're very incredibly grateful to Race Against Dementia as one of our funders as well, and we're always happy to support this amazing work that both the UK DRI and Race Against Dementia do. So don't forget, go to the website. You can find that on the UK DRI website and on Dementia Researcher as well. If you go to our funding listings, you'll find this fellowship and lots of other funding opportunities as well. But you'll get the details and all the links there. Thank you very much again for watching. And as ever, we'll let Sir Jackie play us out to remind us all why this is so important. Thank you very much.
Thanks.
Let's beat dementia together.